I'm Rich Kuchman with Strategic Self-Reliance and Defense, and in today's short video I'm going to continue with the secondary assessment series, and today we're going to specifically talk about the physical exam or the physical assessment. Okay, so secondary assessment, again, just to recap, secondary assessment follows the primary assessment. Primary assessment is meant to identify life-threatening injuries and treat them, sometimes called the initial assessment. So the primary assessment has been accomplished. We're into the secondary assessment. The previous video, we talked about the first piece of the secondary assessment, which is the chief complaint. So the victim's chief complaint, what they're complaining of, shortness of breath, ankle hurts, ankle pain, headache, whatever the case may be. That's the chief complaint. And then we talked about the sample history. So down and dirty medical history, including symptoms, allergies, medications they're taking, past or pertinent medical history, last intake and output, and then the events leading up to this situation. All right, so that we've already covered. Now today, physical exam. All right, so what we're talking about here is a hands-on physical exam, head to toe. Really, we're looking for, we love our mnemonics in medicine. We're looking for dots, deformities, open wounds, tenderness, and swelling. That's what we're looking for, okay? And this is going to be a hands-on, so we have to place our hands on the patient. So always, if the patient's with it and conscious, and you should always explain to them. You've introduced yourself, you've stated your qualifications in very brief. I'm a nurse. I'm here to help you. Simple, right? Explain to them what you're going to do. I'm going to give you a once over. I'm going to look at you closely, make sure there's nothing else going on that we're missing, and then ask them permission. Is it all right if I touch you? Okay. To do this, you may have to remove some clothes, expose the patient. Think about the environment. Think about who's around. Think about modesty and privacy, and expose only what you have to expose, and do it a piece at a time. You're going to be using your hands. You're applying a gentle but firm pressure, so you're going to be touching, touching everything, touching the arms, touching the legs, touching the belly, the chest. Okay. As you're touching them, you're going to be asking, does that hurt? Or you just tell them and then remind them throughout the exam. Anywhere that I touch, if it hurts when I touch it, let me know. Okay, I need to know. Does this hurt? Does this hurt? Does this hurt? Kind of gets repetitive and annoying. Remember, wear gloves. You're dealing with blood and bodily fluids. Protect yourself. Wear gloves. Dots, deformity, open wounds, tenderness, swelling. Think of symmetry as well. If you want to throw another S in there, right? Symmetry. Our arms should look the same. The sides of both of our collarbones should look the same. Now, you may or may not be able to tell here, but I've got a previous injury where I have a separated shoulder. So I have a asymmetry, non-symmetrical from left to right. My left shoulder just tends to droop more than my right shoulder because it's separated. All right, so head to toe, gentle firm pressure, wear gloves, start at the head, right? So I'm not going to cover this in great detail, okay, but I'm going to kind of talk to you about what you're going to do. So wearing gloves. Does this hurt? And you're just feeling, right? We call it a sweep. You kind of sweep your hands under the head, and you're looking for a reaction. They ooh, that hurts. They grimace. They pull away. They try to grab your hand because it hurts. You're looking for blood on your gloves. Is there blood on your gloves? Are there cuts? Are there depressions? Right? Lacerations, whatever the case may be. So the skull and the scalp. Look at the eyes, the nose. You might have to look up the nose. The mouth. You're looking at the teeth, the tongue. See if there's any teeth missing. Tongue's lacerated. Look at the jawline. Is the jaw symmetrical? Can they open and close their mouth? You can look at the ears. You're not talking about an exam into the ear, but you're just looking at the external ear. All right, so that's the head. The neck, look for a stoma, right? So do they have a hole in their neck to breathe through? Are they wearing a medic alert necklace that might tell you something else that maybe they weren't able to tell you or they forgot to tell you? Maybe they were unconscious. Look at just the symmetry of the neck. Look for obviously swelling or injuries, penetrating injuries. Look for, if you, with some practice, you would kind of touch down the spine and you're looking for any abnormalities. We call them step-off fractures, but it's, where the vertebrae lie on top of each other. If there's a fracture or a tear in the integrity of the structure of the spinal column, it will kind of misalign and you'll feel that step off on the spinal column. So you can feel there, you're doing this gentle but firm. All right. Shoulders and chest, you kind of squeeze the shoulders together and just feel for integrity. You can look at the collarbones, right? Clavicles. You can palpate along, touch along those. Touch along all the ribs. Does it hurt? Touch along the sternum. Does any of that hurt? And you're looking while you're touching. You're touching and you're looking. Okay, you're looking for, again, deformities, open wounds, tenderness, and swelling. Okay, another thing you can look for when you're looking at the chest. Have them take a deep breath. And both sides of the chest should rise equally. If what we call excursion, if one side, inflates, the other side doesn't move much, there's a problem. Okay, so you're looking for equal excursion. All right, abdomen and pelvis, so stomach and pelvic area. Again, you're looking for abnormalities, look for swelling, look for bruising. When you touch the belly, you might touch lightly at first and then a little deeper in all four, what we call quadrants of the stomach. But just touch around and see if you can elicit, you're not trying to hurt them, you're eliciting pain. Is there something that's tender? Okay, that kind of give you a clue what's going on underneath the skin. The pelvis, you can squeeze the pelvis, kind of like you squeeze the shoulders. Squeeze internally, grab around the pelvis and squeeze. It should move. It should be firm. It's a bony structure. If it gives or it causes a lot of pain, there's probably a pelvic fracture. So, be careful of that. Now, pelvic fractures can bleed a lot too, so be cautious of that. Another thing that you can think about when you're talking about the pelvic region, think about things that we don't want to talk about: incontinence and priapism. So, normally adults are continent of bowel and bladder. We should not pee or poop ourselves. But sometimes if we are in a traumatic injury, now there's other things that cause it, seizures and things, but if you have a spinal cord injury, sometimes, unfortunately, you can lose control of bowel and bladder. So, and the other piece of that is the priapism. In males, if they get an erection, priapism, it doesn't go away. This isn't because they're sexually stimulated, it's because they have a spinal cord injury. So you wouldn't expect somebody to have an erection after a traumatic injury. So look for that. All right, so abdomen, pelvis. We've got extremities left in the back, I suppose, but extremities. So arms and legs. So you kind of just sweep down the arm, right? Kind of touch everywhere. Look at your gloves. Is there any bleeding? Each finger, touch each finger, right? While you're doing this, you can do things like have them, open and close their fingers. You can have people move range of motion on all their extremities while you're looking at that part of the body. But you're just kind of looking at the extremity for dots, deformities, open wounds, tenderness, and swelling. All right. Fractures, dislocations, soft tissue injuries like sprains and strains, contusions. Look at symmetry. Are the two arms the same? And again, I've had a humeral fracture, so that this arm's nice and straight. This arm kind of goes down. All right, that's asymmetry, but that's an old injury. I can explain that away. Circulation, motion, and sensation, what we call CMS. So circulation, motion, and sensation. Motion is kind of what I said. Can you move what you're supposed to be able to move, right? Can they not move it because it hurts? Or can they not move it because they can't feel it, they're paralyzed, right? And along with movement, there would be sensation. Can you feel me touching? Can you feel me touching, right? And then circulation is kind of, you could check a pulse if you know how to do that. You can look at the color. Is it pink? You can squeeze the nail bed, and does it go from, you squeeze it and all the blood gets squeezed out, it's white, and then it turns back to pink. Circulation, motion, sensation. Right? That'll give you a clue if there's a problem with either circulation in the extremity or a nerve injury. Okay, and then don't forget the back. All right, last but not least, the back. You got to log roll somebody. If you think there's a spinal cord injury or whatever, you got to have a couple people protect that C-spine. Get them on their side. Look for, again, dots. Deformities, open wounds, tenderness, and swelling along anywhere on the back. So again, you can touch the ribs in the back. Look from neck to crack of the butt there, and look at the entire back to see if there's any penetrating injuries or contusions or lacerations, whatever. Don't forget, again, you can walk down the spinal column and feel for those step-off fractures. All right, so that's a down and dirty on physical exam, physical assessment. All right, the head to toe. So again, this is part of the secondary assessment. It followed the primary. So we've covered now chief complaint, the sample history, the physical exam, all we've got left. Next time around, we'll do vital signs. Okay, and then we'll finish up the series with a little discussion on how you document this so you can remember it all and trend it and track it and hand that information off to EMS down the line. All right. Again, my name is Rich Kuchman with Strategic Self-Reliance and Defense. Thanks for watching, and I hope to see you in class.